Brad Ott. I'm a member of the committee to save Southeast Louisiana Hospital. I have had friends who were treated here, and it allowed them to recover in ways that other facilities didn't quite make it. And I had been the co-founder of the committee to reopen Charity Hospital in New Orleans. I'm a former charity patient. I had a stroke in 2003, sitting too long on a trip. So get up and walk around. It's very important. And develop leg clots. But they reversed most of my paralysis, and at that time I realized it was 2003, a year of major budget cuts, just like this year, and I just vowed that I would try to do something, and so I got involved with that fight at that time, and then, you know, I served on an advisory board for Region 1, which is New Orleans area, for the uninsured. That Kathleen Blanco, you might remember, she had her healthcare reform.
Right.
So I was a consumer representative for Region 1, and then so anyway.
So what is you know, I know you've been working with the Community Save Southeast Hospital, with employees, former employees. Describe what this experience has been like for you, and what you've seen happen to these people.
Well, it's been heartening and heartbreaking at the same time. The community, as you've seen, people passing by here, there's still widespread support for the original workers of this hospital. And it was really evident to us that you know, they have a solid base of community support. And you know, it's in kind of the unlikely place. It's the land of, this was Bobby Jindal's old congressional district. This was the heartbeat of Republican politics. And actually a lot of Republicans have come out to support us and support the workers here and the care. And
do you think people understand what's happened here? Because they got this North Lake behavioral health system. Do you think people understand that the hospital's closed and that all these people have been laid off?
Well, I think people are understanding that privatization and the decisions being made is contrary to what people had expected and what people had wanted. And it's clear that, you know, it's part of the reason why we're still able to keep fighting. I mean, obviously, you know, it's been a very heartbreaking situation, because when people are laid off from their jobs and they need to find work, and you know, so that's been. I serve. We have a labor legal committee, and these workers decided that they were going to challenge the layoff, and so more than 200 of the 500 workers that were here filed formal appeals in advance of the layoff decision at Civil Service. And you know, and they wrote the appeal out, and I'm a former editor and journalist, and so I helped, you know, edit for them. But they've come up with what they've wanted to say, which is that layoffs should not have occurred here. There were people who were exempted from the layoff, the CFO, the CEO, the COO, you know, head of nursing. And actually we're contending that those people, such as the CEO of this hospital, who's now the CEO of this private hospital, use state resources and state time to prepare the private hospital to utilize the remaining state resources that were being left to them. And we're saying that that's wrong, and civil service needs to step in and interrupt this and hold them to account. So I think, obviously, in these last weeks, since the formal layoff happened January 2nd, we've been just trying to pay attention to the layoff decisions, and then also trying to look after workers who decided they have had to come back here and work for less pay and less benefits. And
isn't one of your the committee working to try to get an extension of health benefits to those workers that were laid off? Isn't that one of y'all's demands? That's
a demand. It's basically to restoration of positions, and if restoration of positions can't happen, then there needs to be the lump sum payments that could have been afforded workers who were laid off and who otherwise weren't facing retirement. And also that to have health insurance, to get through the year, because that's been a tremendous thing. This workforce in this facility before January 2nd provided the safety net, and now these very workers need a safety net, and they don't have health insurance themselves. And so it's a basic demand. And we're bringing it out both in the public way and asking the public to support, and at the same time through civil service we're trying to use the civil service rules that are afforded every state worker. And we would certainly urge, and I think the workforce here realizes that they may be the first ones, but they're not the only ones. I mean, for OK Long, they're facing a layoff of almost 800 workers in the next month, and the New Orleans Hospital, Chabert, and Homa, Lafayette, UMC Lafayette, all those workers are going to face layoff. They all have to make decisions on, do I stay in state government when I'm nearing retirement, or do I lose my opportunity to have all that retirement benefit? And it's a terrible tragedy. And of course, as we have seen, people are leaving, and that's destabilizing the health system. You can't blame workers for leaving, but that also destabilizes the health system. And the kind of safety net that we've had, it's eroding away.
All right. Thanks, Brad.
Thank you. Thank you all for coming.
You bet.